Welcome to this module on translating the evidence. This is where the rubber hits the road, as the saying goes. Even the best evidence only makes a difference when applied well. Let's look together at some strategies for best translation. What do we mean by translation? The Webster Dictionary defines translation as an act, a process, change, or a conversion. Practically speaking, it's moving the best evidence into our professional practices. What is the purpose of translation? The goals? We're all about the best outcomes, first for our patients and then for our team and organization. Best outcomes also involve lower risk. Are we meeting safety goals, privacy standards, reducing incidence rates? Are we creating the best value? Yes, we need things to be cost-effective as well. This benefits patients, the team, and organization. But value also means that patients and team members find the methods acceptable and meaningful. Beyond the definitions and goals, it can be helpful to see the big picture or the whole process before we look at the details. Don't panic. You may not be a framework kind of person, but stay with me. We're using the Knowledge to Action framework to give us an awareness of the process of translation. An orderly process can help us avoid oversights that can hijack our success and outcomes. We start in the middle with knowledge. That's the evidence. You have been reviewing how to find and appraise that evidence in previous modules. We'll look together at each step in the outer circle or cycle with practical tips and strategies that you can apply. You may not have studied or used the Knowledge to Action framework specifically, but you have seen or used similar processes. The most basic steps of the Knowledge to Action framework are on the left. Have you used the PDSA improvement cycle? This cycle is used very commonly in quality, process, and performance improvement efforts within organizations. I'm guessing all nurses recognize the list on the right. It's the nursing process that we all learned in our basic nursing education. Each of these processes apply to translating evidence, and they all have similarities. They are all cycles, meaning that you repeat the steps as needed to keep the best practices and outcomes evolving. Even if we find the perfect solution and plan for now, the situations change and we'll need to reevaluate and adjust. Okay, here's another familiar topic for nurses and other healthcare team members. Tracking complex processes can be a challenge. All organizations and teams have a level of complexity, and healthcare is especially complicated. We'll need to plan for our translation to include really effective communication and documentation. What's the old saying? If you didn't document it, you didn't do it. We may want to roll our eyes, groan, or wish there wasn't so much charting or documenting to do. But the fact remains we must communicate with a large team, often in multiple locations and on multiple shifts. Without documentation and other effective tools for communication, our actions will be chaotic and our goals unrealized. Let's jump right into the first step of the process, identifying a problem. We are all pretty familiar with the quality benchmarks and indicators that are part of healthcare. Regulation, accreditation, and reimbursement are all based on indicators of quality and outcomes. But even without these reasons, careful assessment and data analysis are needed for objective decisions and best outcomes for each patient. It seems self-explanatory, but some examples may help. Much of the time, the process starts with irritations and questions that arise in daily practice. Something is inefficient and causing frustration for patients or staff. Someone makes a suggestion that takes us by surprise or intrigues us. Or our organization or department may have already identified some goals that we can link into. Ideally, we could be looking beyond our own work environment for new ideas and advances. Engaging in professional organizations, conferences, and journals or journal clubs can help us stay current in the evidence base and best practices. We need to look at all these types of input and ask, why are these things happening? Have you heard of root cause analysis, asking the 5 whys, process mapping? These strategies can help us understand a situation more fully and accurately. We need to understand the core issues, not just the surface issues, in order to find the best solutions. When a topic or problem has been identified, the next step is to assemble a team. A team can be helpful even before the topic is chosen, but additional members may be needed based on the topic that is selected. More heads and more hands make the work more doable. The time constraints and complexity of most environments require sharing the workload and expertise. Think of all the types of expertise that might be needed. Who is impacted and what can they contribute? Involving people from related disciplines and roles helps to avoid barriers, gain resources, and share responsibilities. Important team members include clinical nurses to provide practical expertise, therapists, pharmacists, providers, and other clinical team members. Leadership to provide organizational perspectives and resource guidance. Educators to help with communication. Quality specialists to help with measurement and change processes. Technology experts to incorporate helpful tools. Don't forget patient or customer input. Solutions are no good if they don't work for all the beneficiaries. Of course, teams require good communication to work well, but it's worth it. In earlier modules, you learned about searching for and appraising evidence. A team can help with this as well to speed and sharpen the process. After finding the best sources of evidence, you and your team will need to summarize. What is the most valid, reliable, applicable, and clinically meaningful evidence for use in your environment? Make sure you have considered your current standards and assessed your current situation. Identify new research and ideas, regulatory requirements, professional guidelines from reliable sources, and your own context and patient values. Here's another word picture to stick in your memory. Making plans to solve a problem without the best evidence and indications for success is like throwing spaghetti at a wall. Some may stick, but most of it will fall in a pile that isn't useful and makes a mess. Even what sticks probably isn't pretty. Greater successes are achieved more quickly when we plan carefully using evidence that has already been demonstrated as helpful in other instances. Clarity is a good thing. With your evidence base now in hand, set some SMART goals. This level of detail communicates a specific focus for the whole project team. The goal statement should clearly identify the specific problem. State baseline measurements and set targets for improvement. Reflect realistic and attainable expectations and state a timeline for your project. Here are a couple of examples. Within 3 months, we will design a cleaning process for patient rooms that ensures consistent disinfection of high-touch objects with room turnovers accomplished in 30 minutes or less. Does this goal meet all the SMART elements? Is it specific, measurable, attainable, realistic, and time-based? What do you think? While there is a good bit of clarity and detail included, you may see the need for more. How do we define consistent? This needs to be more specific and measurable. Here's another example. Within 6 months, we will increase the percentage of patients who get a follow-up blood pressure reading after an initial hypertensive reading from 37% to 75%. Does this goal meet all the SMART elements? Is it specific, measurable, attainable, realistic, and time-based? Is this an acute or an ambulatory setting? How do you define hypertensive? When will you repeat the reading? Take your best shot at revising these goals or stating your own goal. You're ready to develop a plan for action. Remember the PDSA process we mentioned earlier? This is where we begin translating the evidence. Take the evidence you've summarized and develop the details needed for implementation. Write or revise policies, protocols, and procedures for reference and consistency. These may be used for an initial small-scale rollout or more broadly and permanently. Seek support and resources. Talk with leaders and co-workers to build buy-in and make sure the supplies, equipment, time, budgets, human resources, etc. are possible and ready. Communicate the evidence you have collected and educate everyone who will be impacted. Make the information approachable using methods that work in your environment. Consider sharing journal articles for review and discussions with coworkers. Highlight the current problems and need for solutions. Open communication can build excitement and understanding and provide good input you haven't considered. Keep the plan organized and manageable. Don't rush it. You don't want to sabotage the results by racing to a solution. It takes time to plan and implement well. The time you spend in planning can serve to minimize barriers and leverage things that could facilitate the plan. Resources are important. We all know that resources aren't limitless. We all have budgets. Plan to get the most value. Aim for the best return on investment, the best outcomes for the least cost. This includes time and financial considerations. Look for creative ways to use resources. Where are resources wasted? Can you reallocate to more useful and valuable methods? Within any organization, there are systems that may make changes easier or more difficult. Assess what systems could influence your plan. How can your plan work within the systems? Could it be possible to improve a current system as part of your plan? This is another reason it can be helpful to collaborate with a team and with leadership. Within work groups and teams, there are many individual personalities and ideas. This can be both a barrier and a facilitator. Ultimately, the diversity of backgrounds and ideas can allow you to explore the options more fully in the planning process. You need both those who may be critical of the plan and those who promote it initially. Setting respectful behavior standards and ground rules for group interactions are always good starting points. Win over your practice team with objective evidence instead of just personal opinions. By cultural barriers and facilitators, we mean the organizational context instead of the individual characteristics we just mentioned. There are elements in an organizational culture that can be both barriers and facilitators. Assessment and awareness of unspoken expectations, values, habits, and rituals can facilitate the plan. We have already touched on the importance of measurement in identifying the problem and setting goals. Let's look at this in a little more detail now. The measurements collected before starting the project or implementing the plan are baseline measurements. They tell us about the situation when we started. Process measurements can include continual or intermittent reassessment of the baseline measures during the implementation process. These could be weekly, monthly, quarterly, or after each step in a series of interventions is completed. For example, you're trying to improve pain control for patients. Baseline measures might include pain ratings, types or routes of pain medication used, satisfaction scores, or knowledge assessments. Process measurements can also include audits of how consistently new behaviors and processes are being done. As an example, your plan includes nurses doing verbal teaching about pain with each patient and providing a scoring tool to the patient. Process measures would include audits of how consistently the patients received the tools and whether the nurses documented the teaching. Outcome measurements should match or reflect the baseline measures. Have the goals been achieved? Have the outcomes improved? Have incident rates been reduced? Have satisfaction or knowledge levels increased? As mentioned before, expenses or return on investment may be part of your baseline and outcome measures. Have costs been reduced? Has value been gained in other ways? For example, patients with good pain control now have less complications, readmissions, or office visits. The investment in the new practices created value by reducing related costs. Charts and tables are great ways to communicate data over time. They allow everyone to see changes clearly. When you have a solid plan based on the best evidence, it's time to make sure you have all the necessary support and approval for implementation. You will find that strong evidence from your literature search and appraisal will go a long way in getting support and approval. It's hard not to support things that have been proven to work well for patients and clinicians. Your team should be in agreement based on the evidence, but you also want the buy-in of a broader group of your peers and colleagues. Your organization may have professional governance committees or councils. Contact the chairpersons and present your plan for their input and approval. If you don't have a professional governance structure, you can still share at staff meetings or department huddles. As we mentioned before, unit and organizational leadership have awareness and responsibility for resources and broader organizational issues. Their approval will be needed to support implementation as well. This should not be a big barrier if you had leadership input on your team from the beginning. Make sure you share your plan and get the level of approval needed. Is there any chance your plan might be research instead of simply applying valid and reliable evidence in your environment? Did you review the literature, show that parts of your plan have already been tested and are safe and helpful? If you are simply applying reliable research evidence or expertise in your plan, it does not require IRB or institutional review board approval. The risk to patients and staff would not be greater than the current practices. In fact, the risks should be lower based on the evidence. This is what we define as evidence-based quality improvement. If you did not find evidence for your issue in your search, you might be considering research. Research involves testing new practices to create new generalizable knowledge. There could be risks to consider for the patients or the staff. This type of plan needs to be carefully considered before proceeding. Does your organization have a nurse or other person with research experience? Do they have an IRB or an academic partner with research experience? These persons could help you know and prepare if research in human subject protection is needed. You have accomplished a job worthy of celebration to get to this point. You'll find it was worth the effort. Implementation is much smoother with all the evidence and planning. It is often best to do a rollout in a limited area rather than launching to a whole organization at first. These smaller scale rollouts allow for fine-tuning and more success in the long run. Always thoroughly educate and inform groups that will be using the new practices to avoid confusion or inconsistencies. Plan for your project team, other leaders, and resource persons to be readily available and supportive as you begin the new practice or plan. It takes extra support to help peers and colleagues feel comfortable with the new way of doing things. The tendency for all of us is to revert back to our old and comfortable ways unless we have understanding, support, and motivation. Remember, individual face-to-face conversation is still a really effective way to encourage and support change. Try to think of fun ways to encourage the group participating in the changes. Can you plan for a contest or for feedback opportunities? Include food. That always seems to be a good encourager. Healthy food, of course. As we mentioned, there may be a few bumps and surprises as you navigate implementation. Stay alert and problem solve with the work group. Usually, minor adjustments are all that is needed when you've done a thorough planning process. You may even see some unexpected positive benefits. If something more serious comes up, you can certainly pause temporarily to make sure everyone is safe. Don't forget, you're not done assessing and measuring. This is the study part of the PDSA process and the Knowledge to Action framework. You are now collecting your own evidence in the evidence-based process. Don't wait. Start observing and measuring both during the implementation and after. Observe the process and practice. How are things flowing? How are people reacting? Are you finding some barriers? What things are helping or facilitating the implementation? Watch for anything unexpected, either positive or negative. Measure for progress. Use surveys for opinions of those involved. Anonymous options allow for more open feedback. Patient and staff satisfaction surveys are often available or possible. Use audits. Both observation and chart audits will help document compliance with the plan. Develop audit tools with consistent items and scoring. Assign auditors and get permission to observe and access data. Clinical outcomes are very important measures, but can take more time to collect. It may take weeks or months to follow up on some processes and outcomes. It may take further chart review or use of dashboards and databases available in your organization. For example, if you need fall rates, they may be available in dashboards monthly or quarterly. Readmission rates could take time as well. Work with managers and other leaders to track costs and expenses and to calculate return on investment. As more and more of the evidence is gathered, ask, are we achieving the goals? Remember those SMART goals? As we've mentioned before, everyone involved will be adapting the practice. You may also need to adapt the plan based on observations and measures. If so, communicate the observations and measures well to everyone involved. Bulletin boards, messages, personal conversations, or reports in staff meetings may be helpful ways to communicate results and adjustments. You may have other methods of communication that work for your team. Don't forget the evidence. You may need to go look for more ideas and information through additional literature searching. When you get to the point that all is working well, it's time to make the practice permanent or even extend it to a larger part of your organization. Occasionally, the evidence and plan simply doesn't work in a different context or organization. If no amount of adaptation will work, if it takes excessive time and resources or causes more risk, the plan should be abandoned. This doesn't happen very often when you follow this evidence-based process, but be aware that it can. It can be a challenge to sustain and grow a new practice. I'm sure you've experienced the flavor of the month phenomenon before. That's when something only lasts for a short time, and as soon as you focus attention on something else, it disappears. When you have carefully implemented something with positive outcomes, you don't want it to disappear. Here are some ways your team can help sustain and grow the practice. Keep supporting, asking for feedback, and auditing to make sure it's still working. Keep sharing the results and benefits in the months ahead. If barriers arise, make adjustments. If you haven't already written a permanent policy, procedure, or protocol, make it official in your system. Tell other departments about your successes, share at conferences, or write an article to help others outside your organization. Those who have done the translation process find there is a unique rush or feeling of joy, energy, and accomplishment that comes from translating evidence into practice. You can translate evidence on a small scale in your interactions with individual patients or on a unit, department, or organizational scale. But when you see the best evidence help you jump the barriers and bring solutions and better outcomes, it's an exhilarating experience. When you have translated the evidence, you have investigated, collaborated, innovated, navigated obstacles, improved practice, and even discovered what doesn't work. It's all part of the process. Identify the next challenge. It's rather addictive in a good way.